Good afternoon. My name is Barongo Tea, and today we're here with Ogita Productions to create a documentary of an account of the development of pharmacy in Kenya. As you know, the University of Nairobi is hitting a milestone, 50 years, which is a great feat, and so we just want to go back to the moment where it began and see the account of the people who started. And so, thank you for coming here and being with us. We appreciate your consent to this process. And as we begin, kindly introduce yourself so that we get to know who you are, and tell us when you first studied pharmacy, where you trained, and when you entered into the field of pharmacy, where did you begin? What sectors did you begin in?
Okay, my name is Professor Francis Ndemo. Actually, my early education started here in Kenya. I did my A-levels in Strathmore, won a scholarship to do pharmacy, Bachelor of Pharmacy in Leicester, School of Pharmacy in the UK. After that, I came back and I joined the industry in the private sector. But then thereafter, I won another scholarship, a Fulbright scholarship to do a Doctor of Pharmacy in University of Minnesota College of Pharmacy. After that, I did what we call a postdoctoral fellowship in an area called clinical pharmacokinetics. Then, upon completion, I actually joined the University of Nairobi in 1987.
Oh, okay. In 1987 to...
1987, that's when I started teaching as a lecturer in clinical pharmacy.
Okay.
And maybe what I can say is my early experience before I did my doctorate, I'd actually worked in industry, like Dow Pharmaceuticals. I was a production manager. I even joined Sterling Winthrop as a new products manager. That's before I joined the university and then took that scholarship for the doctoral training. But again, the doctor of pharmacy is actually more clinical. So when I came back to University of Nairobi, I actually was a pioneer in introducing the component of what they call a clinical pharmacy. That is the direct patient care of pharmacists.
Okay. And I think from just your brief introduction, I hear you've held some positions of influence as a lecturer and being a pioneer of clinical pharmacy in the country. And so, tell us more about your experience in those positions and how they helped you shape the development of pharmacy in the country.
Yeah, actually, it's a very good question because when I did there's a reason why I want to go back to this. When I did my A-levels, most of us were destined to do medicine, and indeed I was actually admitted to the School of Medicine in Baton University, but I had passion for drugs and medicines. I wanted a profession that would deal with the medications. But at the same time, I didn't want just to do with the product alone, but I just want to make sure that I practice in an area where I would direct patient contact, and this brought me to clinical pharmacy. So it was I believe I was the third to be trained in this degree, the Doctor of Pharmacy. There were two others earlier on, but I believe I was the first one. I was the very first one in the University of Nairobi, for that matter. And my drive to pursue the clinical aspect of pharmacy was there was a lot of evidence of drug-related problems. We now know that, in fact, the third leading cause of death is actually medications. So, and the profession, per se, I felt very strongly, should be geared, and the current mission of pharmacy right now is to ensure that patients, every drug the patient gets should be the most appropriate, the most effective, the safest possible, and that the patient is able and willing to comply with instruction to get the best actions. So, talking about the influence or the impact that I had in the profession was it was quite trying because there were very few of us, not very many pharmacies, and a few pharmacies in town and so forth. But I was bothered about the image of the pharmacist per se, because there was a lot of emphasis in what we call distribution and very little to do with the direct patient care. So that, when I became president, or chairman that time, president of Pharmaceutical Society of Kenya, I campaigned for the adoption of the title doctor. That's the pharmacy doctor. You do realize we're medical doctors, we're dental doctors, veterinary doctors, but the pharmacists were not doctors per se, with that reference. So during my tenure, and along with the other members of the profession, Dr. Tebe, Dr. Karanja, and so forth, we actually made sure that there was in our constitution within the professional society, that's Pharmaceutical Society of Kenya, to adopt the title. And then for the first time, also our students started taking a professional oath. You do realize pharmacy is a profession. And professions, without giving a lot of details, they are born out of need. What society has done for profession is they have given them powers to make decisions on their behalf. In the case of pharmacy, patients or the community expects you to be experts in the drug quality and also in their use. So the common man or the consumer has given those rights and given to the pharmacist. So, but in return, the pharmacist is expected to share their knowledge and expertise to give the best outcomes of the drug therapy. In that way, and to be able to do that, the pharmacists have to take a professional oath. So I had to introduce, in 1989, we actually introduced that professional oath for the first time. And from now on, it's been a tradition because we're a noble profession. So, and that had a huge impact in the way you do realize that recently, all the other doctors, be it medical doctor, dental doctors, they're in one group, I believe now, the KMBDU, but that was never the case before. So I believe, and as we went along, later on, in the School of Pharmacy, before I went back to teach in the US, we even introduced a postgraduate program, Master of Pharmacy, MPharm, in clinical pharmacy. Clinical meaning is different from the other distributor aspects in the sense that this one focuses on the clinical aspect, on the pharmacist-led clinical work. So, but right now we've trained several graduates who are actually clinical pharmacists, and they're occupying a very good position in the country.
And I believe that also goes to touch on your impact on society. As you said, that profession has a role to play in the society, right? They come out of need. Yes.
So, for sure, the one thing you're probably not aware, maybe you're aware, in the healthcare, the medications is the most common intervention. You know, when you're sick, you'll have a surgical case where you're being operated. Even if you're being operated, you must be on medications. So medicines, per se, or medications, are the most commonly used intervention. Number two, they actually, what do you call it? In the healthcare budget, you'll find almost like 60% is allocated to medications. So the profession that is responsible for 60% of the health budget must be important, right?
Yes.
And now, again, is the other thing you may realize, you're very much aware about disease outbreaks, malaria, and what have you. But I'm sure nobody talks very much about drug-related deaths. The reason why is because the current model is that the person who prescribes is the same one who's going to write the death certificate. So they underreport for the number of deaths. I'm not saying that that physician or medical doctor, they do a good job. But all I'm saying, it's a huge public concern when it comes to medication use. There's evidence out there that people suffer. Road accidents, what have you, people who take medication, even for pilots, pilots are certain drugs they're not supposed to take. So really, when it comes to medication, so the new responsibility, initially, we're dealing with the quality of products. But now there's enough evidence there's inappropriate use of these medications. So the saying now goes, it's not that they are bad drugs, but they are good drugs used inappropriately. So, but the profession that has stepped forward to address this issue is actually pharmacy.
Yes.
And now, coming about that, there have been a lot of change. Actually, School of Pharmacy, University of Nairobi specifically, has been doing a good job. But now I feel strongly it's a high time they move on to these new programs, like the one I did at Doctor of Pharmacy. This is what you call a CBE, competency-based education, or CPC, I don't know which you're familiar with. Is we're into what we call a skill-based economy. It's no longer how much we know, chemical structures and what have you. It's what you can do with those medications, make the best outcomes. And the newer programs now are these doctoral programs. The Doctor of Pharmacy is, strictly speaking, I was a chair of the training and assessment committee in the board. We've come up with a curriculum, although it's not been fully approved yet, but these are newer curriculum now been adopted by West Africa, more than 20, almost like 30 countries in the world. So the only thing is that we've been slow to change. But otherwise, it was, University of Nairobi has been an icon, and it still is, of a pharmacy education. So for now, it's a high time we transition to these newer programs.
Okay. And how do we achieve this transition? How do we achieve, because you're somewhat giving us your vision of what pharmacy practice should be in the future, more practical. And so how particularly would we achieve this? The
only way is now when you talk about a competency-based curriculum, it actually means you have to start with the end in mind. What sort of skill sets do we need? That's where you begin. And the FIP, this is the Federation of Pharmacy Education, FIP, I keep confusing it. But I'm saying they've come up with a competency, a global competencies of what is expected of a pharmacist. Based on those competencies, which we have now captured in what we call a good pharmacy practice document we've been working on. It means we now know, and then we also, what we have also done with those competencies, we have also come up with quality indicators. How do we know you're doing a good job? That is contained in that document. But this, having established the competencies, you work your way backwards, then you now have to look into the curriculum and see what the deficiencies are. But my advice, if I were to be given the advice, is to start with a clean slate, not modifying what we have. Because this one, when you produce, when you introduce a doctor of pharmacy, all the education is highly contextualized. You start seeing that patient almost from year one. Are you getting me?
Yes.
And the difference between what currently we're having, Bachelor of Pharmacy and Doctor of Pharmacy, is that in the case of Doctor of Pharmacy, the skills training, the actual skills training occurs at the university. But the model we have at the moment, the academic portion is done and you graduate, and then you go for internship afterwards. The internship is no longer under the realm of the university. But the other models now, especially like in Britain, they have moved on. Because right now, pharmacists are being trained as independent prescribers. In the National Health Services, those are the first people you see who examine you, physical assessment, everything, and actually prescribe. That's another issue that has yet to be addressed. So the question is, how do you plan? First and foremost is to have those good pharmacy practice guidelines adopted or gazetted. Number two, to actually make sure the curriculum is changed, right?
Yes.
The professional programs now, globally, they are moving towards graduate level of training before you practice. The Doctor of Pharmacy is a graduate degree. And even the MPharm, the Master of Pharmacy in England, UK, they do, is an advanced degree program, which means they have recognized, the profession has recognized that you cannot fully be competent with a bachelor's degree. So that's why they have now more advanced professional degrees. So my question is, not only do we have to change the curriculum, but also the trainers of trainers. These people are training, most of us, slightly outdated. I must say, because these are new competencies, they probably never went through them. They've been good, they were good in our times. I'm not saying I'm outdated, right? But I believe very soon there are newer areas that have come up ever since I graduated. Some we deal with genetic information to guide your, what we call pharmacogenomics, to actually guide your treatment. So all I'm saying is that number one, you make sure that the curriculum, the outcomes you need are defined, and the process in which you are going to use to achieve those outcomes is also well defined by making sure you have the facilities. Facilities are very important. And both what you call the strength and the quantity of the lecturers or the faculty. You have to. Because the product you produce will depend on the level of training of those ones. So really, we have challenges in the sense that the facility may be wanting, the training of the girl for these new skills, and making sure the curriculum is up to date to actually follow the global trends.
Okay, thank you very much. And now as we wind up, we want to focus on your particular impact and what you want to be remembered for. And perhaps maybe together with that, what would you have liked to have the opportunity to change? Just briefly. Maybe you've mentioned it throughout the interview, but just now.
No. In a summary, number one is to overhaul the current curriculum. Literally. There's no point being isolated and being a quote-unquote a sovereign state when we're not globally competitive. Right? That's number one. Number two, the reimbursement for the clinical services. At the moment, all the compensation is pegged to the product, the drugs. Personally, I actually practice as a pharmacotherapy specialist. I run a clinic. We call it medication therapy management service, which we're pushing in under SHIF to be compensated for. At the moment, the pharmacy is not looked as a healthcare provider, just like a dentist or a physician. They've always been authorized sellers or poison their distributors. But I'm now talking about actually an independent clinician who should be paid for. So compensation is important, curriculum is important, and a change in scheme of service in the country so that it can recognize specialization within pharmacy. I believe if we can achieve that, I'll be more than glad. Thank you.
Okay. Maybe what you'd like to be remembered for, just...
Oh, one word?
No, not one word. That's it. But I also asked what you'd like to be remembered for. That's, unless... That's
no, what I will remembered for is, number one, as a person who introduced a professional order and the title doctor. Number two, potentially, hopefully 1 year or two, the person who introduced a doctor of pharmacy in the country. Number three, I also remember that I fought for the image of the pharmacist. Thank you.
Okay. And now, because we're doing this, sorry, just one last thing.
I think it was the last time.
Yes. The University of Nairobi, would you have any words of congratulations or any best wishes to congratulate them on attaining 50 years since the onset of the School of Pharmacy?
No, actually, I need to congratulate them, and they've been doing very well. They've been doing a wonderful job, because even during my time, the best students in the medical school were actually pharmacy students most of the time. They have, despite the limited resources, they've done a good job, and I still believe is a mother of all pharmacy schools in this country. So congratulations on 50 years.
Okay, thank you very much.
Oh, thank you.
Come to the end of the interview.
Okay, thank you.
So,
We want to take a photo of you.
Huh?
We want to take a personal photo of you.
Oh, okay. No problem.
One that you
But I